The arrival of the Dutch-flagged cruise ship MV Hondius at the Port of Granadilla in Tenerife marks a critical juncture in what has become one of the most complex maritime health crises of the decade. Following a weeks-long odyssey through the South Atlantic, the vessel, operated by ocean-wide expeditions, has become the epicenter of a multi-country hantavirus outbreak that has claimed 3 lives and triggered a global contact tracing effort. The situation began as a routine expedition that departed from Ushuaia, Argentina, on April 1st, 2026, carrying 147 passengers and crew members representing 23 different nationalities. What was intended as a journey through the remote landscapes of Antarctica and isolated South Atlantic islands transformed into a public health emergency when passengers began exhibiting severe respiratory distress. Health officials have now confirmed that the pathogen involved is the Andes virus, a specific and particularly dangerous lineage of hantavirus. While most hantaviruses are strictly zoonotic, meaning they do not typically spread between people, the Andes virus is the only known strain capable of human-to-human transmission. This biological characteristic is precisely why the World Health Organization and the Centers for Disease Control and Prevention have elevated their response levels. The geography of the outbreak is expansive. The ship's itinerary included stops in South Georgia, Nightingale Island, Tristan da Cunhas, St. Helena, and Ascension Island before it was effectively blockaded from standard ports of call. This part of the Atlantic, usually known for its isolation, became a high-stakes environment for medical surveillance as international agencies debated where the vessel could safely dock. The primary concern for viewers and the global community lies in the virus's mechanism of action. Hantaviruses are traditionally associated with rodent reservoirs, where the virus is shed in urine, feces, or saliva. Humans typically contract the illness by inhaling aerosolized particles of these waste products in confined or poorly ventilated spaces. However, the clusters identified on the MV Hondius suggest a secondary phase of transmission: close, sustained contact between individuals in the tight quarters of a maritime environment. As the ship sat off the coast of Cabo Verde earlier this month, the stakes were high. 3 fatalities had already been recorded, and several more individuals were in critical condition, necessitating a coordinated international evacuation strategy that is only now beginning to conclude in the Canary Islands. The core developments of this outbreak center on a series of clinical events that began shortly after the ship left South America. According to official reports from the World Health Organization and national health focal points, the suspected index case, referred to as Case 1, was an adult male who had spent 3 months traveling through Argentina, Chile, and Uruguay before boarding the vessel on April 1st. He developed symptoms of fever and gastrointestinal distress on April 6 and died on board 5 days later. The tragedy deepened when his 69-year-old widow, who had disembarked in St. Helena and traveled to South Africa, also succumbed to the virus in a Johannesburg hospital on April 26. A third death involving a German woman was confirmed on May 2. These fatalities underscore the severity of hantavirus pulmonary syndrome, or HPS, which is characterized by a rapid progression from flu-like symptoms to acute respiratory failure and shock. The laboratory response has been equally intensive. While initial tests on some passengers were inconclusive, specialized PCR testing and genetic sequencing conducted in South African and Dutch laboratories eventually confirmed the presence of the Andes virus. This confirmation shifted the narrative from a localized environmental exposure to a documented chain of human-to-human transmission. The logistical challenges were compounded by a diplomatic standoff. The regional government of the Canary Islands, led by Fernando Clavijo, initially opposed allowing the ship to dock in Tenerife, citing a lack of technical criteria and public safety guarantees. This led to urgent high-level discussions with the Spanish Ministry of Health and Prime Minister Pedro Sanchez. Ultimately, the ship was permitted to moor at the Port of Granadilla on May 10, but only under strict biocontainment protocols. Throughout this period, the ship's own medical staff were not immune. The ship's doctor and at least one expedition guide were among those infected. The doctor was eventually medically evacuated to a specialized isolation unit in the Netherlands. Currently, the CDC has classified this as a Level 3 emergency, coordinating the repatriation of American citizens to high containment facilities, such as the Nebraska Biocontainment Unit and Emory University Hospital in Atlanta. These developments highlight a grueling timeline where the verified data from health agencies often trailed behind the rapidly evolving clinical reality on the water. As the MV Hondius sits in the Port of Granadilla and passengers are repatriated to countries including Australia, Canada, France, Germany, and the United States, the focus has shifted toward long-term surveillance and prevention. Public health guidance remains clear. Anyone who was on the vessel or has been in close contact with confirmed cases must undergo active symptom monitoring for a period of 45 days. This extended window accounts for the unusually long incubation period of hantaviruses, which can range from 1 to 6 weeks. For the general public, health officials emphasize that this is a contained event linked to a specific vessel and geographical origin. Maria van Kerkhove of the WHO has explicitly stated that this does not represent the start of a COVID-like pandemic. Prevention strategies on the ground and at sea now focus on environmental hygiene. Because the virus is often spread through aerosolized rodent waste, experts advise against dry sweeping or vacuuming in areas where rodents may be present, recommending instead the use of disinfectants and wet cleaning methods to prevent particles from becoming airborne. In a maritime context, this has meant a total overhaul of the ship's ventilation and cleaning protocols. Despite the successful evacuation of the passengers, significant uncertainties remain. Investigators are still working to determine the exact point of exposure for the initial cases, whether it occurred during shore excursions in the Andes region or through an undetected rodent presence on the ship itself. Furthermore, while human-to-human transmission has been confirmed, the exact degree of contact required for the virus to jump between hosts is still being studied by disease detectives. The limits of current medical knowledge regarding the Andes virus mean that there is no specific vaccine or antiviral treatment currently approved, leaving doctors to rely on supportive care and early intervention with oxygen therapy. As the world watches these former passengers return home to quarantine, the message from official agencies is one of cautious optimism tempered by a massive surveillance effort. This incident serves as a stark reminder of how quickly a localized viral threat can become a global logistical challenge, requiring unprecedented cooperation between shipping lines, port authorities, and international health bodies. For the latest updates on this and other global health reports, consider subscribing to this channel. The core developments of this outbreak represent a harrowing sequence of clinical progression and international coordination. According to the World Health Organization and the European Center for Disease Prevention and Control, the timeline began on April 6, 2026, when a 70-year-old Dutch man on board the MV Hondius first presented with high fever and respiratory distress. By April 11, he became the first fatality, though the cause of death was initially attributed to natural causes. The situation escalated dramatically following a scheduled stop at St. Helena on April 24th, where 29 passengers disembarked. Among them was the index case's 69-year-old widow, who traveled to South Africa and died in a Johannesburg hospital just 2 days later. By May 2nd, a third death was confirmed, a German woman who had remained on the vessel, while a British passenger was airlifted to South Africa in critical condition. Laboratory analysis, conducted by specialized facilities in South Africa and the Netherlands, provided the definitive breakthrough. The pathogen was identified as the Andes virus. This discovery fundamentally altered the global health response, as the Andes virus is the only known hantavirus capable of human-to-human transmission. By mid-May, the case count reached 11, comprising 8 confirmed and 2 probable infections, including at least 1 crew member. The logistics of managing the infected vessel became a subject of intense diplomatic and public health debate. After the ship was unable to conduct a safe evacuation at Praia, Cape Verde, it remained in a state of effective blockade for several days as authorities weighed the risks of landfall. The regional government of the Canary Islands, led by Fernando Clavijo, initially expressed significant resistance to the ship docking in Tenerife, citing concerns over local biocontainment capacity. However, Following high-level intervention from the Spanish Ministry of Health and Secretary of State for Health Javier Padilla, the vessel was permitted to dock at the Port of Granadilla on May 10. The arrival was met with an unprecedented military and medical mobilization. Members of Spain's Military Emergencies Unit and the Civil Guard secured the industrial port, where white biocontainment tents were erected along the quay. Passengers were transferred from the MV Hondius via inflatable Zodiac boats in small, controlled groups to minimize the risk of aerosolized exposure. As disembarkation proceeded, the complexity of international contact tracing became clear. Former passengers had already transited through major hubs, including a reported contact case in Tahiti and another being monitored in eastern Spain. The U.S. Centers for Disease Control and Prevention elevated the outbreak to a Level 3 emergency, coordinating the return of American citizens to high containment units, including the Nebraska Biocontainment Unit. Meanwhile, the Spanish government confirmed that 14 of its nationals were transferred to a military hospital in Madrid for mandatory isolation. Despite the scale of the operation, health officials have been careful to contrast verified data with public anxiety. Genomic sequencing has confirmed that while the virus is a virulent strain of the Andes lineage, it does not currently show signs of being a new or more easily transmissible variant. The ship itself departed Tenerife on May 11, bound for the Netherlands for specialized decontamination, as agencies like the ECDC continue to monitor over 120 individuals now scattered across 12 different countries. As the immediate tactical response to the MV Hondius transition concludes, global health authorities are shifting their focus toward long-term surveillance, rigorous prevention protocols, and the resolution of lingering scientific uncertainties. The primary directive issued by the World Health Organization and the Centers for Disease Control and Prevention Centers on an extended monitoring period, because hantaviruses, and specifically the Andes virus strain, can have an incubation period lasting anywhere from 1 to 6 weeks. Any individual who is aboard the vessel or has been identified as a close contact of a confirmed case is required to undergo active symptom monitoring for a full 45 days. This protocol is critical because the early symptoms, fever, muscle aches, and fatigue, are often indistinguishable from more common viral illnesses. However, in hantavirus pulmonary syndrome, the disease can progress with lethal speed into a cardiopulmonary phase, characterized by the sudden onset of shortness of breath and fluid accumulation in the lungs. Health officials emphasize that early medical intervention, particularly the administration of supplemental oxygen and intensive care support, is the only current method to reduce the mortality rate, which historically nears 40% for this specific virus. Prevention strategies are being disseminated globally, focusing on the specific mechanics of transmission. While the Andes virus is unique for its human-to-human capacity through close contact or respiratory droplets, the primary risk for most remains zoonotic. The virus is carried by specific rodent reservoirs, in the case of the Andes virus, the long-tailed pygmy rice rat. Transmission occurs when human beings inhale aerosolized particles of rodent urine, droppings, or saliva. Public health guidance for travelers and residents in high-risk areas strictly advises against dry sweeping or vacuuming in enclosed spaces where rodents may have been present, as these actions kick the virus into the air. Instead, the use of a 10% bleach solution or heavy-duty disinfectants to wet down surfaces before cleaning is the mandated standard. In clinical and maritime settings, the use of N95 or FFP3 respirators, gloves, and eye protection is required when handling potentially contaminated materials or treating symptomatic patients. For the shipping industry, this incident has prompted a re-evaluation of rodent exclusion protocols and the necessity of high-efficiency particulate air, or HEPA, filtration systems in passenger quarters. Significant questions remain regarding the origin of this specific cluster. Epidemiologists are currently investigating whether the virus was introduced to the ship via a rodent stowaway during its time in South American ports, or if the index case contracted the illness during a shore excursion in a high endemic area of Argentina or Chile. The blockade of the MV Hondius also raises difficult ethical and legal questions concerning maritime health law and the responsibility of coastal states to provide safe harbor during a biological emergency. While the Spanish government eventually allowed the vessels to dock in Tenerife, the delay highlights a lack of international consensus on how to handle quarantine ships in a post-pandemic era. Health officials stress that while this event is severe, it does not suggest a widespread pandemic threat to the general public, provided that the current ring-fencing of contacts remains intact. The limits of current science mean there is still no specific antiviral or vaccine for hantavirus, making surveillance the world's most effective tool. As the 120